last video, we talked about a variety of different perspectives on psychopathology. And this time I want to focus primarily on trauma-informed care. I encourage you to watch Bessel van der Kolk's description of some of the consequences of trauma and how those impact kids in particular. It is a short and very informative video. Basically, he says that kids may experience or show trauma in several different ways. That may be as problems of focus, attention, persistence. Second, their affect regulation is compromised. And so their emotions may become too big and their ability to return them to baseline, is often compromised. They may also run into, engage in a variety of maladaptive behaviors that are a response to this dysregulation. So things like substance abuse, smoking, drug use, self-injury, all of those may be a side effect of this problem of affect dysregulation. And finally, the core narrative of people with relational trauma might be that the world is unsafe, that you're helpless and unable to protect yourself, and if you stood up for yourself, that bad things would happen. So this is often counterintuitive and yet important things for us to pay attention to. So what van der Kolk suggests is that we should help people feel validated and understood. This is why I do this. This is why I feel this way. And to recognize that their bodily reactions are meaningful, make sense, and may be rooted in the past. So the reason that my heart's going like this in this situation is because I've been hurt in this situation in the past. Knowing what you've experienced before helps people reclaim their bodies, emotions, and themselves and learn to become safe in their bodies. So think about the impact of failing to see trauma and failing to acknowledge its role. Basically, instead of, what grandpa did, it's now you're the problem. You are doing things wrong. And think about focusing on individual causes for disorders rather than the family contextual trauma. And think about why we might do that. I suggest that at least part of that is that it makes us feel better, makes us feel safer, because it's not about us. We're not doing anything wrong. And with that, I'm going to say goodbye, and I'll see you in the next video.